Welcome back to an episode of our series with Dr. Ginger Martin. In the last episode, we covered early signs of autism and how parents can spot them. And now, in this episode, we are diving deeper into the autism and ADHD and how to differentiate between the two. Dr. Martin, let's jump right in. Autism and ADHD are two terms that are often discussed together, but they are distinct conditions. What are the key differences between autism and ADHD?
ADHD and autism are going to have definitely some overlap in symptoms, but are each very unique and specific diagnoses. So, um, autism spectrum disorder, as mentioned before, sort of has three different areas of criteria that have to be met, but it's all around social functioning. So, we're looking at deficits or delays in social communication, social engagement, and then atypical behaviors or perseverative interests, rigidities, or sensory needs. So we're definitely going to be looking at the things like um, delayed social development, delayed language, unusual use of language, um, versus ADHD, which has three different sort of diagnostic criteria or diagnostic categories. So ADHD can present as hyperactive impulsive presentation, which is, as it sounds, an individual or a child who's going to present with hyperactivity, difficulty sitting still, restlessness, impulsive behaviors. Um, the second category would be ADHD inattentive presentation, and that presents with symptoms of inattention, distractibility, difficulty focusing, disorganization. And an individual could have just the hyperactive impulsive presentation or just the inattentive presentation. The third category is an ADHD that is a combined type, which involves all of it. So it would be all of those symptoms together. And so, although at a young age, we want to be careful that we are looking specifically at are these symptoms of autism versus are they symptoms of ADHD? When you're doing a thorough evaluation and are looking at each of those in the symptom categories, we're able to piece apart, what symptoms are under the autism umbrella and what may be under an ADHD umbrella. There definitely are some areas of overlap in terms of individuals with ADHD can present with some social delays. They also can have an overlap of sensory needs. Um, and oftentimes the two diagnoses are comorbid, meaning they both are diagnosed together. So it's common to have both of those on board at the same time, but it's not always the case.
On that note, Dr. Martin, we also see many kids are getting diagnosed with both autism and ADHD. How does having both conditions impact diagnosis and treatment?
Sure. Yeah. So, in order to fully assess both of those, a comprehensive evaluation needs to be done. And so, we want to make sure that the diagnostic process is not too narrow, that we're not just only looking at symptoms of autism and not looking at anything else that could be going on with the child. So, having a really thorough and comprehensive evaluation is really important, where we're looking at, I really like to kind of cast a wide net to make sure that we're looking at, you know, behavior concerns. We're looking at attention and focus. We're looking at sensory. We're looking at social language. So kind of keeping the whole child in mind. And then within that evaluation, you want to have very specific assessments that are looking specifically at symptoms of autism and then specifically at symptoms of ADHD so that we have sort of the broadness, but also the narrow focus to make sure that if we have warning signs or we have some red flags that we're looking in depth to really assess autism and ADHD on their own. And then if we're looking at how the impact of the diagnosis can affect treatment, again, we want to make sure that treatment is incorporating all of those needs and that it's focused on the whole child rather than just focusing on one diagnosis or the other.
So, you mean like, do they need more therapies and evaluations?
So yeah, it really does depend on the individual presentation and what symptoms are most prominent. So for sure, if we have both diagnoses that are made, then the treatment plan may look a little bit different than if we just have one versus the other. There are going to be specific treatments that work for children with an autism diagnosis and then maybe some slightly different treatment options that would work for a child with just an ADHD diagnosis. So when we have both, we definitely have to incorporate all of that. Um, it's more about looking at specific behaviors that are the most um, problematic or impacting the child and their daily functioning. And so that could be social or that could be hyperactivity and inattention. So it sort of depends on the individual child. Through the evaluation process, part of that process is about really creating a plan forward and a specific treatment plan for that individual child because each presentation is slightly different.
As you mentioned, there is a clear distinction, but we need to watch more closely. There is a stigma that ADHD is just about kids being hyper. Can you explain a more accurate way to describe ADHD and what parents should watch for?
ADHD has those three different components to it. So we have the inattentive symptoms, which are just being distracted, off task, difficulty finishing a task, disorganization, forgetfulness. Um, and that can certainly be its own diagnosis that is sort of ADHD inattentive presentation. That on its own is often a little bit harder for teachers and parents to pick up on because it can be a little bit more subtle. It's not an overt behavior, but it may be difficulty functioning at school, falling behind with grades, difficulty with completing homework. And so that would be sort of signs to keep an eye out for under the inattentive presentation. The hyperactive impulsive type is often what people think of when they think of ADHD, and often what will bring a parent to give a call for an evaluation because the behaviors can be more overt and more sort of problematic in terms of daily functioning. So these are going to be restlessness, difficulty sitting still, leaving their seat, impulsive behavior, which can lead to behavior concerns, restlessness, needing to move their body a lot, just difficulty fidgeting and things like that. And so these are signs and symptoms that are a lot more obvious and may result in, a teacher or a parent, noticing the concerns. And then, of course, we have children who have both of those, inattentive presentation and the hyperactive impulsive. And so those individuals are struggling with both the inattention and the hyperactivity. And so when we're thinking about ADHD, one of the metaphors that I really like to use is the idea of a window. And so an individual with ADHD, um, their brain is functioning such that it's requiring a high level of stimulation. And so if we think about a window with no screen in it, and everything is able to come in, everything is of equal importance to the brain. The brain is not filtering or deciphering. I don't need to pay attention to that. I need to focus on my teacher, or I don't need to, think about what's on the TV. I need to talk to mom or dad. Everything is coming in. It's sort of the same level of importance. And so they are needing, having difficulty filtering out what is of pertinent importance and what they can kind of put on the back burner. And so the brain is also seeking a high level of stimulation. And so all of that information coming in is providing that stimulation. And so one of the things that we'll find is that, children are engaging in some of the restless behaviors because their body is seeking the stimulation in order to focus. This is also why individuals with ADHD will be able to focus on things that they enjoy or activities that provide a high level of stimulation, like TV, movies, video games, or just something that they enjoy doing, building Legos, working with puzzles, reading, just whatever meets that need for them, for their brain to get that level of stimulation can actually help them to hyper focus. And so where we think of ADHD as a difficulty with focusing, it certainly is, but it doesn't mean we can't focus. It just means we need a high level of stimulation for the brain in order to lock in and focus.
That actually tells me that this high level of activity helps them to achieve higher goals in life and positions. We see many examples for this in the society.
So the ADHD brain can be very creative, very quick thinking, very able to problem solve. So there's so many strengths that come along with it. It's just that functioning in daily life and being able to meet their potential can be impacted by some of the symptoms.
ADHD manifests differently in boys and girls. How does ADHD typically present in girls, and why it is so frequently overlooked in them?
Yeah, there is something to it. So actually, boys are definitely have are more likely to be diagnosed with ADHD than girls. I think the current statistics is girls are 16 times less likely to receive the diagnosis than boys. And that, there's a couple of reasons behind it. One is that um, I think boys tend to be diagnosed more often with the more obvious hyperactive impulsive symptoms. It's something that calls more attention, and so it's something that in the classroom is noted to be disruptive, and it kind of is an externalized presentation of the diagnosis, and so it's more likely that that seems problematic and needs to be attended to. And boys tend to present a little bit more with those hyperactive impulsive presentation. Girls traditionally, not always, it's not always the case, but may present with more of the inattentive symptoms. And because of just some cultural expectations, it may be easier for those individuals to sort of slide by for a while until maybe, middle of elementary school or even middle school when, the demands get so intense that they may not be able to compensate for the inattention and the distractibility and the difficulty with organization and keeping track of things. So it definitely is something that we see some differential in terms of the way that, those two genders are diagnosed.
Many times, parents do see different behaviors at home compared to school. Why is that so?
Yeah, absolutely. So home and school are always going to be fundamentally different. So a school setting, when you walk in the door the very first day, there are rules, there are expectations, there are routines in place from day one. And home is just not like that, right? It we can have the routines and rules and expectations, but it's so much more fluid, right? There's not a start and stop date to being at home. And so um, some children will respond more to the routine, the structure, and the expectations at school, and may come home and have more difficulties because the routine is different. On the flip side, there are some children that perform very, very well at school and may be really internalizing the stress that it takes to to maintain focus and attention in school, and then come home and they let it all out at home where it's really safe to do so because mom and dad are going to love us no matter what. And so we can definitely see that difference where sometimes the teacher is calling and saying, we're seeing this behavior at school, and parents are saying, I've never seen that behavior. Likewise, parents may meet at a parent conference and say to the teacher, oh my goodness, we see this after school homework is so hard to get through. And they may say, oh, she's a joy in class, no problems here at all. So for sure, just the nature of home and school can create those differences. And it's a good point because we want to, when we're looking at diagnosis, whether it's ADHD or autism, the symptoms have to be present in more than one setting. So we can't have only ADHD symptoms happening at home and nowhere else. Can't only be happening at school and nowhere else. It has to be pervasive in terms that it's presenting itself in every setting, whether it's home, school, grandma's house, my office, the grocery store. It has to be very, pervasive, something that's happening in all settings.
Yeah, that is a conflict often seen by parents and teachers. Finally, for parents dealing with attention struggles, emotional regulation, or impulsivity, what are some strategies that you recommend for helping at home?
In terms of dealing with attention difficulties, emotional regulation, impulsivity, for sure, every child is going to be a little bit different in terms of what's going to work best for them. But good places to start are working with the emotion, sort of the basics of emotional regulation and communication. So awareness and identification of emotions, and then some simple coping strategies are going to help. So the more that the child has awareness of their behaviors, their emotions, the more that they can exert some control over them. So we want to teach some very basic calming strategies, coping skills, so that they can start to implement those. Certainly, praise and reward systems for positive behavior, for doing the right thing, definitely help to modify behavior in the right direction. So that could be a helpful approach to figure out. And then, in addition to helping kids learn self-regulation skills, we want to, maybe introduce some mindfulness or some calming strategies so that they can start to regulate their nervous system. And mindfulness can also help with focus and attention as well. So it's definitely a variety of things that would be sort of created and a treatment plan that works specifically for that individual child. But these are some good starting places.
That's it for the episode 2 of our series. We hope you now have a clearer understanding how autism and ADHD are different and how they can sometimes overlap. In episode 3, we will be talking about what happens after a diagnosis. What is the evaluation process and what steps should parents take to support their child? So don't miss episode 3, where we will dig into diagnosis, next steps, and therapy options. Thanks again for joining us, and we'll see you next time.